Welcome back to the deep dive. Okay, today our mission is super focused. We're cutting right through the noise about testosterone blood tests. We want to give you the essential info, why they matter right now, and crucially, how to make sure those results are actually accurate. We're drawing on insights from a guide about getting this kind of test, specifically looking at info from the website Blood Test UK. They're talking about services in places like Hereford. So it's not just the test itself, but also like the practical side of getting good health data.
Exactly. And what's really interesting here is, we're not just looking at one single number. We're assessing a really foundational hormone. It's critical for energy, how your body's built, mood regulation, all that stuff. If you know a bit about this, testosterone levels, they fluctuate, right? They can change quite a bit, which makes the timing and, the accuracy of this test super important, paramount, really.
Right. And we care about getting that accurate picture because if those levels are off, the symptoms, they can be kind of vague, but really draining. We're talking about feeling tired all the time. That kind of deep fatigue rest doesn't fix, or, changes in muscle or fat, or even just big shifts in how you feel, your vitality. When that stuff keeps happening, testing becomes, necessary data gathering.
Precisely. So why is checking your levels, getting that data, such a crucial step? It really comes down to early detection. We're not just trying to spot major hormone problems. We're looking for trends, subtle shifts maybe, that could point to an underlying issue. Maybe metabolic stuff or changes in bone density before they become serious chronic problems.
Okay. So it's not just for diagnosis, it's preventative too. So if a problem is spotted early, how does that actually help with, getting better care?
Well, it leads straight to what we call informed treatment decisions. It means doctors can tailor a plan for you. Maybe it's specific lifestyle tweaks, diet changes, maybe some hormone support. But it's based on your specific body chemistry, not just guesswork based on symptoms. Plus, for anyone already making healthy changes, like a new diet or exercise plan, regular checks give you objective progress tracking. You can actually see if what you're doing is making a difference, moving the needle.
Okay, that makes sense. Let's talk practicalities then. The test itself sounds really quick. Someone cleans your arm, usually the inner elbow, quick needle stick into a venipuncture, right? And they take a small blood sample.
Yep, usually over in just a few minutes.
But actually getting the test, the logistics, that sometimes stops people, doesn't it?
That's exactly where this localization idea comes in, like the setup discussed in our sources focusing on Hereford. These local clinics, often sort of decentralized, they're designed to make it easier. Less friction. They simplify scheduling. Sometimes you can even get same-day appointments. That makes monitoring your health feel practical, even if you're already feeling, tired and run down.
Yeah, that easier access sounds like a huge win for actually getting people tested. And the sources also mentioned the human element too, right? Like that story about the patient who was anxious.
Oh yeah, the friendly nurse who helped them feel comfortable.
That positive experience, that's part of making it accessible too, isn't it? Not just the location.
Absolutely. Patient experience is definitely key. But let's shift gears slightly to maybe the single most critical factor for getting a good result: preparation. Our sources really stress the need for specific timing. Why is the time of day just so fundamental for this test's accuracy?
Right. That's the kind of practical detail our listeners need. Why can't I just, pop in after lunch, say 3 p.m.?
Good question. It's because of something called diurnal variation. Basically, your testosterone levels naturally peak early in the morning. Typically, that's between about 7 a.m. and 10 a.m. If you test later, say in the afternoon, you'll naturally catch a lower level. And that could give a misleadingly low result, kind of skewing the whole picture for your doctor.
Okay, so a morning appointment is pretty much non-negotiable then. And what about fasting? Why do I need to skip breakfast? I need to understand why I can't grab that coffee and pastry on the way.
Right. You generally need to fast, usually for about 8 to 12 hours beforehand. Just water is okay. It's because eating, especially carbs and fats, can trigger hormonal responses in your body. Those responses can temporarily push your testosterone levels down. So that sugary breakfast, it could actually give you a falsely low reading, which might invalidate the whole test or lead your doctor down the wrong path. It's all about getting the cleanest, most reliable snapshot possible.
That makes total sense. Accuracy through prep. Okay, so let's say you do all that, you get the test. What happens if the results aren't quite in the normal range?
Well, if your levels are outside what's considered the ideal range for you, the doctor will likely suggest some clear, simple next steps. Nothing scary. It might involve checking some other related hormones, maybe looking into lifestyle factors, making some changes there. The main goal really is empowerment. The results are just information, the data you need to take control of your health story long term.
That sounds like really vital knowledge for anyone wanting to manage their own health and vitality.
Yeah.
Okay, so our parting question for you this week is this. What's one small piece of crucial health information you're currently missing that maybe, just maybe, you could find out this week? Think about it. We'll catch you next time for the next deep dive.